So today we'll be doing a quick overview of diabetes. But before we get there, we'll first have to look at how blood glucose levels are controlled in the body. This is because the key defining characteristic of diabetes is that of an abnormally high blood sugar level or blood glucose level in the body. So in terms of blood glucose control, blood glucose is maintained by two key hormones produced in the islets of Langerhans of the pancreas, that being insulin via our beta cells and glucagon via our alpha cells. Insulin is released in response to a hyperglycemic state. For example, when you eat a sugary meal. This comes into your gut, which is then absorbed into the body, where it absorbs into our bloodstream, thereby increasing the blood glucose level in our blood. In this case, what happens is insulin is released by our pancreas via our beta cells and activates via transcription factors, increasing production of glucose transporters at our tissue sites to increase the uptake of glucose from the bloodstream. Additionally, it also acts to promote lipogenesis as well as protein synthesis and increasing glycogen stores in the liver. Glucagon, however, is the opposite of this, and this is often seen. It acts in response to a hypoglycemic state. A good way to remember this is when the glucose is gone, glucagon activates and basically acts to reverse insulin's effect on the body by promoting glycogenolysis, gluconeogenesis, and lipolysis, thereby increasing the amount of available glucose for the tissues when in a hypoglycemic state. Now moving on to diabetes mellitus. Diabetes comes from the Greek word meaning to go through, and mellitus comes from the Latin word for sweet. That's why it's often correlated to the passing of sweet urine. The crux of the disease is that there is an abnormally increased level of glucose in the blood. And this is either because the body is unable to produce enough insulin, or it isn't responding to the normal amount of insulin being present. In terms of diagnostic tests used to diagnose diabetes, these are our hemoglobin HbA1c levels, or our glycated hemoglobin, which is a compound created due to high glucose levels within our bloodstream or irreversibly binds to hemoglobin. And due to the 120-day life cycle of our red blood cells, this test is done every 4 months and gives us a rough estimate or average of the blood glucose level control of our body over those 3 months. And therefore, it is the most accurate out of the 3 tests here. Any value that is greater than 6.5% results in a positive diagnosis for diabetes. Additionally, we have fasting glucose. That is a patient who's fasted, usually overnight or with an 8-hour delay from eating. Their blood glucose level is measured. Any value of a blood glucose above 7 millimoles per liter is indicative of diabetes. Additionally, we have the random glucose test as well. Any value above 11.1 millimoles per liter is counted as diabetic. However, due to certain situations where variations could occur, such as the person just had a meal and whatnot, this value is the least accurate of the 3. And if a patient is suspected of having diabetes, it is then further checked via the other 2 testing regimes. As noted before, the cause of diabetes is either the person not being able to produce enough insulin or the body not responding to normal levels of insulin. Type 1 diabetes is when a patient is unable to produce enough insulin or there is no production at all of insulin, leading to our high levels of glucose within our blood. And therefore, type 1 diabetes mellitus is a condition in which the beta cells of the pancreas have been destroyed due to inflammation and scarring as a result of a type 4 immune hypersensitivity. This resulting in scarring and the breakdown of our beta cells, being unable to function properly and therefore being unable to produce insulin. Type 1 diabetes usually has an onset in childhood and that is why it's often said to be called juvenile onset diabetes or insulin-dependent diabetes mellitus. However, there is also the case in which there is a latent activation of type 1 diabetes, which is known as our LADA, or latent autoimmune diabetes in adults. A rare condition, but it is when patients spend the first part of their life normally having normal insulin production within their pancreatic cells, and then somewhere down the track, there is an activation of their type 4 hypersensitivities, which results in the breakdown of the beta cells within the pancreas, leading to it being unable to produce insulin. In terms of treatment, as there is no insulin production and there is no problem with cells responding to insulin, it's that there is just no presence of insulin, the treatment regime is to provide exogenous insulin, often via injections, to cause the body to uptake sugar from the blood. Now we move on to type 2 diabetes. This is also known as non-insulin dependent diabetes, as patients are not voided of insulin production as opposed to that of type 1, this is also known as adult onset diabetes, as the majority of patients who develop this condition are that of older age compared to type 1 diabetes. In type 2 diabetes, the body fails to respond to the release of normal levels of insulin due to dysregulation of insulin receptors on the target tissue. This is known as insulin resistance, making it harder for the body to respond to increases in glucose levels with normal insulin release. So the body compensates for this by increasing the insulin production and secretion by the pancreas, but eventually the pancreas is put beyond its ability of homeostatic control and therefore starts to fail. This results in the pancreas producing less insulin, or the insulin that is produced is not as effective due to manufacturing defects due to the increased stress placed on the pancreas. This leads to even less uptake of glucose by our target cells, thereby leading to high glucose levels within our bloodstream, thus type 2 diabetes. In terms of treatment pathways available, it is either by increasing the uptake by our cells or by increasing the excretion of glucose out of the body to reduce our blood glucose levels. Additionally, with lifestyle and dietary management, in which we decrease the amount of sugar entering into our bloodstream. So this is a slide that summarizes the pathophysiology, risk factors, clinical features, investigations, and treatment of type 1 diabetes and type 2 diabetes. The key thing to note here is that in terms of the clinical features, these signs and symptoms can be found in both type 1 and type 2 diabetes, and therefore should be correlated with a history as well as investigations to make and confirm a diagnosis, especially with the case with rising obesity rates in the younger population. Stating a patient who's young and has diabetes or high blood glucose has type 1 diabetes is no longer always true, as it may be due to type 2 diabetes.